Hello everyone, this is Dr. Kishore Alapati. I'm a consultant colorectal surgeon located at Apollo Hospitals Jubilee Hills in Hyderabad. Today we'll talk about perianal abscess. It's a very common condition that we see in the general public across all age groups and across both the genders, both males and females. So perianal abscess is a situation where in the buttock someone develops an abscess or a boil. In a technical plain English word, it's called a boil, where you have pus formation within the buttocks. The most common thing that one comes across when they have a swelling in the buttock area is they go see their primary care physician in their closest place, and then they get prescribed antibiotics. What is important is, after having prescribed an antibiotic, whether it is a tablet or IV form, it's very important to examine these patients to see how severe is the infection and how bad is the infection. How extensive is it in the buttocks is what is definitely important in the process. And so while assessing that, it's also important to perform what we call a rectal examination. A good number of times, which means 70 to 80% of the times, these abscesses will respond to antibiotics appropriately, and about 30 to 40% of the times they will have to have a surgery done, initially what's called an incision and drainage. So most commonly an IND, technically it's called, which is wherein we incise the area or cut the area where there is the swelling or the pus formation and try to get rid of the pus that's inside the buttocks. What is also important at the time of surgery is to look inside the anal area to figure out if this has any connection to the inside of the anus. About 30% of the times there will be a connection to the inside of the anus, and this is what we call an anal fistula. If there is no connection, then it is probably just a simple buttock abscess that requires an incision and drainage. So perianal abscess, that is the reason why while performing surgery, it is important to look into the anal canal to make sure that there is no fistulous connection. So if you look at the literature wise, meaning sampling multiple patients, about 30 to 40% of the patients who have developed an abscess in the buttock area will have a communication into the anal canal, and these are the patients who would end up having a multiple incision and drainages because of the presence of the fistula. The abscess cavity will never completely resolve by itself. It will always remain as a small pimple that is continuously draining out some kind of slimy material, sometimes pus, sometimes blood. So as long as the slimy material is coming out, they consult their local physicians, and then they go back in for an incision and drainage of that area or continue to use antibiotics. But the root cause is within the anus, where the internal opening is and that is what we technically assess by doing a finger examination or an endoanal ultrasound scanning or an MRI fistulogram to see where exactly this internal opening is, and based on that decide on surgery. So in short, taking care of perianal abscesses is rather simple, but it is very important to examine the anal canal area at the same time to make sure that there is no fistulous communication. So take care of your bowel habits, stay healthy, eat proper diet, have a normal bowel movement, and that keeps you away from all of these troubles. And have a great day. Thank you.